And if we reach at that point whereby if you can afford a bottle of Coke, you can afford healthcare, would have, some form of elevation. Most people will be living longer, happier, healthier lives. What motivated us to start Zuri Health was to actually address the critical healthcare challenges faced by millions of Africans. And that was what drove us to building Zuri Health, leveraging technology to be able to provide quality, affordable, and accessible healthcare solutions for everyone with a mobile device, regardless of their social background, health status, or where they're coming from. Because for us, we understood that, access to healthcare is a fundamental human right. And we have a lot of people grappling with this. So how are we able to really bridge that gap and provide a lot of financial access in terms of lowering cost of healthcare services, providing access on our different channels, be it on a mobile app, on our SMS solution for people living in the rural and underserved areas, as well as on our chatbot. And we deployed a lot of digital tools. Right now, we've seen a lot of impact. We are seeing a lot of people getting their healthcare improved. We are managing now patients with chronic conditions. People who had diabetes, hypertension, can now, we've relieved them of the stress of, managing their healthcare. So we're able to provide a lot of consultations with doctors, pharmacy delivery, lab testing at home. And for this, it has really transformed because we're also working with a lot of limited resources. When you look at the critical problems around access to healthcare in Africa, first of all, is affordability, because it's extremely expensive. And also in terms of the distribution, we have a painful doctor-to-patient ratio. We have very few doctors. We have less than 2% of people insured, which means that majority of people are one chronic condition away from bankruptcy. And in as much as we have a lot of emerging health tech solutions, they're still not solving for the 65% of mobile phone users without access to smartphones or the internet. And this is what really inspired us to really innovate around healthcare and to be able to change people's lives, ensuring that people are now living happier, healthier, and longer lives. One of the craziest moments, I believe, was when we had to pivot our business model to meet the market changes and foreseen changes. I remember that time we were very keen. We were really known for a lot of COVID at home testing, just when we had launched at the peak of COVID. And we knew at some point what happens next after we find a cure, or, there's no much need on COVID-19 testing, especially for travelers. And we had to improvise new ways or strategies to be able to navigate into different models. And we took that as a step to acquire more users and do a lot of cross-border marketing, which also aided in our market expansion. So I always say you have to think about how are you able to build something that is sticky, something that can be easily adaptable when you have the high seasons and the low seasons, and still stay afloat. Build whatever you're building with a passion. You need to understand why you're doing it. There has to be a reason behind it. And don't be afraid to seek for help where you struggle. There are always a lot of mentors available, your fellow entrepreneurs who are facing similar challenges who can help you. And don't be afraid to network. Go out. Celebrate your small wins. I know sometimes you have your first paying customer and you feel like, okay, I wish it gets to 1 million. But celebrate that 1 customer, because eventually from that, it helps you to grow from 1, 2, 3, and who knows what holds for you. But essentially what you're doing is something that is very impactful, and it also guides the younger generation because they're seeing things being done and they know it can be done. So it's good to always say, do the hard things. And eventually we're able to transform and change the African ecosystem together. Working with Build Grow Africa has been very rewarding. We've gained a lot of mentorship, a lot of support, funding support, a lot of network and strategic partnerships. They're both our investors and also our clients, and we're always excited because they bring in a community of even other startup entrepreneurs who we are able to share our stories together and, share what are some of the challenges that we go through together and get that hands-on support. So I would say this has been one of the key wins at Zuri Health. Will Grow backed us up when we were very, very young and small, and they're still holding our hands to date. And this is what we need, essentially. Hi, my name is Daisy Isiaho from Zuri Health, and that has been my recap. To know more about Zuri Health, visit our website at zuri.health, www.zuri.health, or interact with our chatbots and SMS solutions across different channels.